Welcome to the Physio channel. In this video I'm going to show you some advanced shoulder massage techniques, and towards the end of the video I'm going to show you a shoulder mobilization technique. To begin with, I'm just doing some very simple warm-up techniques over the upper back. Then I'm going to pay some attention to the back of the scapula, and I'm going to come below the ridge here, the spine of the scapula, into this area where the muscle belly of the infraspinatus is. And if I palpate around here, there's often some tender points. So if I find one, I'll apply some sustained moderate pressure in order to bring about some desensitization and reduction in pain. So one tool I like to use over the back of the shoulder blade is a cup, and I have here a silicone cup. This is a rock pod. Pop it over the area, press the top down. The pod then reforms and reshapes and creates a vacuum, and that works as a really good soft tissue handle for mobilizing over the back of the shoulder. Also saves your thumbs and can be a bit more comfortable for the patient. If you're interested in the use of cups for therapy, there's some more videos on the channel, and I'll put a link at the end of this video and some information in the description for you. If their shoulder is mobile enough, you may be able to get your hand underneath the anterior humerus there and keep the arm relaxed. Then get some grip over the lower border of the scapula, and then you may be able to mobilize the shoulder blade like so. And I'll show you another technique for doing this in just a moment. Next, we want to get down to the lats and the teres major around here. So we're going to change the patient's position so we can target this area a little bit easier. From this side lying position, it's easier to target the lateral side and the back of the body. Find a point, fix that point, and then move the arm away so that we create some shearing. And this is a bit more of a vigorous treatment, so just make sure that your patient is able to tolerate this. I also like to do that shearing technique with an IASTM tool. I've got here the rock blade. So drop in off the bottom of the scapula, lock in position, and then bring the arm up towards me. I also mentioned I'd show you the scapular mobilization from the side lying position. So pop your arm underneath the patient's arm like so that your hand can go on the medial border of the scapula. The other hand goes over the top of the humerus. And by moving the shoulder back a little bit, by having a bit of internal rotation of the arm, the scapula will pop up if the patient is mobile enough, and then we can mobilize the scapula like so. And what you can also do is pull the scapula up away from the center of the spine so that you're giving the rhomboids a stretch, and then you can combine that with a muscle energy technique as well. So if I pull the shoulder blade away from the center of the spine, and then ask the patient to gently pull their shoulder blade back towards the center of their spine, and relax. Good. I can stretch it away a little bit further. Once again, get them to pull their shoulder back towards the center of their spine, and relax. Okay, and this can really help to loosen off that scapulothoracic joint, which can do wonders for shoulder mobility and reducing shoulder pain as well. Had some great results from this in the clinic and great feedback online from some of our other videos. So please let us know in the comments what you think of these techniques, and in particular the scapular mobilization. Next, we'll put the patient in the supine position and do some spiral massage over the upper humerus. So from here we'll start in a comfortable internally rotated position of the arm, and then we'll place our hand over the upper humerus and rotate the arm passively as we internally rotate with our massage using the opposite arm. I'll get you in a bit closer so you can have a look at what I'm doing. So starting with the arm in an internally rotated position, a comfortable one, I'll then place my hand over the top of the humerus, massaging into internal rotation as I then gently bring the arm into external rotation, in combination with some external rotation exercises as well, which of course you'll find on our channel in the shoulder treatment playlist. So this is the external rotation. If you're wondering, well, what if internal rotation is restricted? Well, you've already worked out the answer, of course. That is to go the other way. So starting from a comfortable position of external rotation, get your hand underneath the humerus, bring the soft tissue around into external rotation as you then internally rotate the arm like so. And yes, you can go in both directions. And of course, that will help to free up the shoulder in both directions if you're looking for a general treatment or if there is a restriction in both directions. Now, we've done a few muscle energy techniques, so of course you can add them in here as well. So I can ask the patient to push against my hand and sustain that for a few seconds and relax, and then bring the massage in as I move them back into external rotation. From this position, we can also do some massage over the upper chest. From the seated position, we can do some work on the muscle bellies of the deltoids, and that can easily be achieved by doing some petrissage. Okay, so to finish off this video, I'm going to show you the mobilization technique for the shoulder. Place your hand over the back of the shoulder. Place your other hand over the front of the humerus there. And then ask the patient to lift their arm as you maintain that gentle posterior glide. That's that glide towards you. And as you continue to stabilize the scapula. Good. You can ask the patient to retest the movement without you doing the mobilization. And you should see an improvement in range of motion. This works particularly well for shoulder pain syndromes. I'm talking here about rotator cuff issues, or you might know it as an impingement related issue. The names are debatable, but that's the kind of pathology that we're looking at. Doesn't work so well for frozen shoulder, unfortunately, but of course you can still try it with a frozen shoulder. It doesn't really make sense to use it for shoulder instability either, but the most common type of shoulder problem is that shoulder pain syndrome, which, as I said, could be rotator cuff or impingement related, and this mobilization can work really well. In combination with the massage techniques we've done, if you combine those two things, you'll usually get some very good results after just 10 to 15 minutes of passive treatment and active input as well. So that's it for this video. There should be some other videos showing on the screen here now, which I mentioned, which you may find helpful. I'll put some other links in the description below, which may be useful. As I mentioned in the video, please leave a comment to let us know which of these techniques you found helpful, or your patients, and we look forward to seeing you in the next video. That's it for this one. Thanks for watching. Please like, subscribe, and share with anybody who you think may find it helpful.